Hi, my name's Emily. I'm 16 years old and I'm here with my mom, Buffy, and my sister, Morgan. She's 18. And I had my lipedema procedure yesterday. It went really great, smoothly. I didn't have any pain basically the whole time. I'm a little sore today, but that's expected. I'm super excited just to see the results in the months to come. Well, I had been working out for like almost a year with a personal trainer, and I had been eating a really great diet, anti-inflammatory. Everything was going well. I started to lose a little bit of weight in my stomach, but my legs and also a bit of my arms, it was just super stubborn, and I was not losing any inches or anything, which I thought was kind of weird. Me and my mom both did. So she actually ended up looking up liposuction online just to see if it was even possible to do someone my age with getting liposuction done at all. And she ended up finding a video of Dr. Amron's of one of his patients and talking about how she had lipedema and all of her symptoms and everything. And we just found all the symptoms, and every single one of them just matched up with
we just looked at each other and honestly started to cry, because it was like all of a sudden there was this label to what she had been experiencing, and I really think it started back when she was about 12, like with puberty onset, when you were playing volleyball competitively and wearing spandex, and all of a sudden she started getting really self-conscious about her legs. They just weren't the same as her friends, and that was a hard time because we didn't understand why. She seemed to be really active and eating healthy, and
in the past year, Emily's taken a huge interest in her health and really like completely changed her diet. And one thing that we were doing together was exercising. So it was so interesting to see that, you know, I was losing weight a lot more rapidly than she was, even though she was working out more than I was, and we could see her stomach, because she doesn't have the lipedema really in her stomach. She was starting to get like, I mean, you could see some real definition and tone coming in there, and her legs, if anything, were getting bigger. They were just kind of staying the same. And so it was like so hard to see her putting in so much work and effort and not getting to see the results of it. So finally being able to like know that there's a reason why, I think was a huge part of her feeling
pain
so much better too.
Yeah, I was already having pain, which apparently, being my age, most people don't have that much pain yet, so that was kind of concerning to us to know that I was already feeling that. So that's, I think, why we decided that now is the best time to get the procedure done, just because it's only going to get worse, you know. So,
and we had never even heard of lipedema before.
Yeah. At first, I was upset. I was just because, I mean, she came to me with the video showing me all of the symptoms, and at first I thought she was kidding. I was like, obviously I don't have a disease, what are you talking about? But then it registered with me, and all the symptoms, I was like, oh my god, I do have this. And then once I came to Dr. Amron, when I did my initial consultation, I felt like reassured almost after that.
Relief.
Yeah, that I had been doing everything right, really. I had a great diet, like good amount of exercise, and it wasn't my fault that I wasn't able to lose the weight, which it definitely was reassuring, and it made me feel good. It was good to know that there was something that could be done for it with the liposuction. I'm a junior in high school. I go to an independent study school, and I've had lots of anxiety, social anxiety too, where I definitely think that this has had an impact on that, just because I'm not able to, I don't wear dresses, I don't wear shorts, anything like that. That's just bathing suits. I've never even thought about wearing that, just because I know like I would feel so uncomfortable. Definitely made me less outgoing. I'm more of a shy person, just because I haven't felt comfortable in my own skin. And definitely the pain. I used to play volleyball. I haven't played sports in so long.
body image is such an issue too at this age anyway, that it's like, you know, having something like this that you don't feel like you have control over can be so debilitating. And, you know, it's like you would act like a completely different person, like at home, where you were completely comfortable with us and stuff because, you know, we know everything about you. But then we go into public and you're like so shy and not comfortable wearing certain things. I mean, we would spend hours and hours like just getting ready to go out on a day-to-day basis just to find something that like she feels comfortable in being around people. So it's hard to watch as her sister, you know, like her older sister, her being so young and already affected so in such a big way.
That's definitely one thing I look forward to after seeing the results, is just to be able to like wear whatever I want and be totally comfortable. I mean, already I had it yesterday, so obviously it was like just happened, but there's just a sense of like hope that I'll be able to do everything that I'm supposed to be able to do in my life, and I have now my whole life to live it makes me happy just to know that this won't hold me back for the majority of my life like it does for a lot of people, just because they don't know about it, but it's definitely
yeah, it's emotional to hear that, you know, as her mom. So that's really, we're very grateful.
yeah, for sure.
Very grateful to find Dr. Amron and your team.